Hey, everybody, welcome back. So, we today are going to talk about communicating assessment results. This is something we've been talking about in class for quite a while. We're going to continue to talk about it in class, and now I'll give you the official lecture on it, but I'm probably going to, as we go through this stuff, I'm probably going to say, we talked about this, or we'll talk about it later. I know I do that a lot, but this time it maybe even more. So, I'll try and tone it down as much as I can. Excuse me. Okay. Um, uh, Part of the reason this is hard to talk about and why I'm going to say some of those things, like I just mentioned, is that it's hard without context to explain some of this stuff. I can say generally, but unless we have an example, which we'll do some activities in class, we'll work on our final papers shortly. Until you get that kind of context, it's really hard to explain how to do this stuff. I can't just give you a demonstration. I'll try and do little snippets of what it's like to communicate things as I do, but um, it's just a challenge. So part of the question we have to ask is, who are we communicating to? Are we doing it in writing, or are we doing it verbally? When you're with a client and you're going to introduce an assessment to them or talk about what the results mean, obviously it's verbally. But what we've been practicing in class is a lot of written instruction. In fact, just I don't know, it's a fun little side note, but we were in a faculty meeting the other day and somebody was saying, writing is really important. We need to focus on writing. And we've heard for years that students these days, boy, they don't have the same ability to write like they used to. It's those dang text messages and, that kind of stuff. Too many emojis. So that was true when I was in school. There was this really funny commercial. I don't know if I could find it for you guys, but it was like an early Yahoo commercial. I don't know if you even know what Yahoo is, but Yahoo is kind of like a competitor to Gmail back in the 90s or something. And there was this funny commercial of these guys sitting around a boardroom, and they were just discussing the terminology of technology, which was very new to everybody at that time. And then there was this one guy who was like, "What is this hotbot.yahoo business?" And this other guy goes, RAM, I like that. Sounds aggressive. And it's just really funny because they were just out of touch. And that's why it was funny. But anyway, the point is that we've been talking for a long time about communicating in writing and communicating verbally and how those things are different. And so we're going to talk about that in the context of this discussion that I just had with the faculty about how important writing is. So we'll focus on writing with our final project, and you'll hear me say a lot of things like, um, we're writing to other professionals and we're writing to doctors and attorneys, and this is sort of legal writing and that kind of stuff. And then other times I'll say, we're writing to really understand the heart, and we need to um, write with, I don't know, like self-expression. We need to hear the author's voice. I was an English major and a philosophy major, double majored in those two. And so the writing was just way different. And so I'm used to like poetry and prose. And that technical writing was not my thing. And so I've had to learn how to do that. And so I'm going to be asking you to do these very different skill sets, very different kinds of writing. And they're really important. Just to give you an example, I know I'm going off script here a little bit, but to give you an example, sometimes you're going to be writing about symptomology in the form of a SOAP note or DAP note. If you haven't heard what that is, we'll go over that more. But if you are writing like that, you're just really focused on what are the symptoms. We don't hear the client's story. We don't need to know all of those details, but it's what are the symptoms? What is a person presenting with today? Other times you'll be writing in SOAP notes or DAP notes, and you'll say, what are the details of what the client said, or what was the topic of discussion? You might focus on those kind of things. And yet other times, if you're writing to the client, sometimes let me give you a different example. Let's say the client comes in and wants a letter to excuse them from school for a doctor's appointment. That's a different thing. If somebody wants a letter to support their interest in working with a therapy animal, that's a different thing. And so how we write to these different audiences kind of matters, right? So that's the kind of stuff we're going to be practicing. And that's why writing is so important, because it communicates not only what we're capable of as a professional, but what's going on with the client. And that's necessary. So who we're communicating to matters. Sometimes you don't know. Sometimes you have to assume that it's going to be read by an attorney, right? Like if something legal happens. And sometimes it's parents. Sometimes there's a specific somebody was referred by the courts and they need a response back of like, did the person attend what they were supposed to attend, or did they make progress, or that kind of stuff. So it really depends on who you're writing to, and so we'll talk about the various nuanced circumstances based on your setting of where you're at. And then of course there are unique challenges with each. I think that kind of goes without saying, but we'll discuss some of those a little bit more in a more nuanced way later. Communicating performance is part of an ongoing assessment process, not just something that happens at the end. And essentially, what that means is assessment is dynamic. It's not just you do it at the beginning, it's not just you're communicating results at the end. It's how are we doing? Now, there are some circumstances in which you don't want to communicate performance. For example, if you're doing a really, really standardized test, you don't want to give a person indication that they're doing poorly or they're doing well on the assessment. In other words, I'm just collecting the response. I'm not giving anything back in terms of an indication of correct or incorrect answers. So most of us are not going to be in that situation. And those are uncomfortable for a lot of us because we don't like that degree of clinical separation. In other words, if I'm doing an assessment and I can't give feedback, I just have to say, you know, here's the question, and then write down the result without. You want to build rapport and say like, oh, good, thank you. But if you say good, thanks, it kind of indicates that there's something correct about an answer, and we have to be careful with that if we're doing standardized tests. Okay. So, the communicating performance that starts with setting an expectation, the informed consent. We've already kind of gone over that, so I'll skip that. What do the results mean specifically? We talked about that last week, so I'm going to skip that one too. But there's nuance in how to do that, right? And what you think is important and valuable for the client to know, especially in the context of the kind of evaluation that is. Okay. Now, one thing I'll say that just popped into my head that I think is relevant is that when we're trying to build rapport and we say things like relationship is king, I said that last week. When we say stuff like that, sometimes we say, what if I have a hard result to communicate to the client and I want to maintain the relationship, but it's hard for me to give hard feedback to somebody or like negative results. So I flower it up and I color it up. It's like, oh, it's not that bad. Or like, this really actually is a strength when it's described as a weakness. Like we do those things because we can't stomach the countertransference that we experience based on the results that the client has. Okay. Now, sometimes it's okay to do that, to like help a person digest information. Other times it's really important that we deliver feedback clearly and without a whole lot of expression because we just really need somebody to know this. It's one thing to say, these results, they really do paint a difficult picture. And I want to talk about that with you because sometimes this is hard. Here's an example. Just the other day, I had a client who has diabetes, and he's talking about how frustrating it is to lose the feeling in his feet and his fingers, and how he just feels like he's getting older and he doesn't want to get older. And I said, there might come a time when we have to start talking about using a cane or a walker or a wheelchair just to be able to get around because you're getting kind of unsteady on your feet, and I'd hate for you to fall and get hurt. Would you rather take that risk and maybe have to go to the hospital and with a broken bone, or would you rather take some precautions now? And so, without a whole lot of expression and with just an objective, here are some options that you have. The intention was to help. Let me try. Let me try that again. The intention was to hopefully help him see that this is just a decision to make. It's not necessarily as bad as he thinks. I was kind of inclined, or I wanted to say, I really care for you and I'm really concerned about this. And it's just, we don't have to have this conversation, but I would love for you to be thinking about this so that it's easier to stomach later when we have to actually deal with this. But I thought it would be better approach to do it the other way. Was it? I don't know. It's just, it's sort of those judgment calls that we make. But that's what we're talking about here. We're talking about responding to results specifically, or whether we talk about them in kind of a roundabout way. Okay. So there's a lot of nuance to that, but we'll just leave it there for now. we've talked about this part. What does it mean for the person, for their life, for their treatment, etc.? That's just something you'll get practice with as we go on. One challenge in using language that people understand without misrepresenting scientific precision. Okay. So some of you, I've given you this feedback, or you've heard your peers in class, especially when we were going through the statistics chapters. We were talking about things like standard deviations and confidence intervals and t-scores, and it can be tempting to talk to the client like the t-score means that for every 10 points you go up, that's one standard deviation, which puts you at a different population category and or something like that. And clients most often are like, English, please. What does that mean in English? Which means that we're talking in statistical jargon or clinical counselor jargon, stuff they just don't understand. But if I say, you're scoring higher than most people on this scale. In fact, it's closer to like 70% of most other people. Is that true? Well, what if their score was 65? Do we say 70 or do we say, like there's all these questions of like, do I use precise language or can I estimate and use different language to help them understand that's not full of jargon? I tend to be somebody who prefers using less jargon. In fact, probably less than most people. Um, but then again, that's a decision. Sometimes there are cases where I've had to use very, very, very precise language because the difference really matters. Most of the time though, not so much. So it's helpful to know these things, but we also get to make these choices based on what we're comfortable explaining and what clients are able to accept. Um, and of course, there's lots of opinions on what is right here. Okay, as you can imagine. There's verbal examples of how to talk about standard scores on page 394. I think it's worth going back and just taking a scan at those. The content in the book tends to focus more on explaining the scientific, explaining the statistics. If you need to do that, especially relevant to you school counselors, you may need to do that. If you're working at like a hospital or an inpatient unit or some other setting where the where it's really important to get the diagnostic information correct based on formal assessment results, then you may need to adopt some of that language a little bit more. But um, a lot of us are going to be responding to assessment results in a very different way. If you can recall the class 2 weeks ago that we had where we were looking at the ideal versus the actual self and that Venn diagram I showed you on that Word document online, and we're asking questions of like, what are your fantasies about what you think other people should be doing for you versus what you are expecting of yourself? And how do you see your real true self? Or are you coping or using defense mechanisms to to pretend that you don't have these problems or that somebody else will change if only they could or something like that? And talking about those kind of things is a whole lot different using words than it is talking about assessment results using numbers, right? So the point I'm making here is that the book focuses on more of the dealing with formalized assessment than the informal assessment, which we've been practicing quite a bit in class. So I think I thought there was like, oh yeah. So there's two slides here that actually kind of cover some similar things. Well, maybe this isn't that point yet. Okay, let me just talk about this one. But there's some redundancy here, as you can imagine. We've been talking about some of these things before. Um, Sometimes it can be difficult for people to accept results. For example, the one I just told you about the person who needs to eventually consider using a cane or a walker or a wheelchair. We don't like to grow old. We don't like to look at our own problems. We don't like to take responsibility for our actions. We don't like these things. We don't like to assume that somebody else is being a jerk, but they're actually not totally just being like an evil, awful person. They're just doing things that are self-protective for them. And if we can look at things in a different way, it can be helpful for us, but it's hard to accept that stuff. And so sometimes it's about distrusting results and people not liking the actual results and saying like, I don't believe that. I don't believe there's any good. I don't believe this test is correct. I don't believe you did it correctly. There's that, or there's like even if it's true, I don't like it and I don't want to accept it. So there's this issue of readiness that kind of fits with acceptance too. It's hard to describe the nuances of all those situations, but the best way I can think about it is there's these two categories. One is that people don't like the results and they think that that thing is a problem, which is the thing we do if we don't want to internalize something is true. We blame externally, right? Another thing we do is we develop coping strategies that just undermine our ability to let that stuff sink in. You know what I mean? So, like, I don't know, just give you another example of like, on most days, my self esteem requires that I don't look and think about all of my flaws. If somebody said like, "Yeah, you know, Aaron, you're not really the prettiest guy. You're probably like a, I don't know, like a 6 out of 10 on some beauty scale." You know what I mean? But when I was looking for a partner, it was really hard for me to say like, well, I'm gonna go out and look for a 10 because I have this concept of beauty. So um, I'm just gonna pretend that I'm capable of that. You know what I mean? Or like, shoot your shot, dude. Aim high. And then eventually you have to lower your standards to raise your average. But that's a different story. Hopefully you see what I mean. That's kind of a dumb analogy, but hopefully you get what I mean, which is we have to think of ourselves as better and more capable to manage our self-esteem. And so like we get used to that so that we can feel good about ourselves, but it also makes it harder to internalize the truth when we're really not good at something, you know? On the flip side, some of us think we're terrible at everything and we're super fat and ugly and just, the worst of the worst. And it just isn't true, right? Like and we're looking at things that don't represent our true value or something like that. So there's all these things that we do that lead us to these, I'm just not ready to accept things as they actually are. And that includes test results and a lot of other things in the counseling world. Okay. So, um, this is a little bit of a detour, but one of the hardest things about being a counselor is seeing people as they actually are. We all come in with our own biases and we see people in ways that it's easier for me based on the way that I've learned to cope to help comfort people by saying, oh, it's not that bad. Or, you know, you're actually better at this. And I want you to see your value. So I've gotten so used to saying, you're wonderful, you're special, you're capable, and all that kind of stuff. And I even do some of that in here in these classes. If I think that somebody is really hard on themselves, or I really want to encourage some optimism or some confidence, I'll give you that kind of feedback. And some of you are like, yeah, he's just saying that because he's a professor and he just, like, that's just how he is. He just always says nice things. And it doesn't land because your confidence, your imposter syndrome, your self esteem is just not ready to hear that you actually are good at this stuff or you actually are capable. So, and it goes both ways. Some people think they're really good and they can do all this stuff, and I already know what I'm doing here. I don't need to listen to this. And I'm like, well, but there is a lot to learn, right? Like this is hard stuff. You don't have it all figured out yet. And so we all have the different place on that spectrum of like overconfidence versus underconfidence. And ideally, we'd have just enough for what we deserve. And yet that's hard. Okay. So I don't want to go off on that anymore. But that's what we're talking about here when we're talking about acceptance and readiness. It's how do we say, here's what the data says, and here's what I'm seeing, and then look at our own biases. The tests are built so they don't have as many biases, but that's what we're trying to figure out is what's actually going on. We want to be valid ourselves. We want the test to be valid, and that's the point of what we're trying to get to here, okay? The problem area is even if we're objective and we're good at being being valid for lack of a better term, I guess, or like seeing things as they actually are. And the tests are too. Sometimes the clients just aren't ready for that because they're just not ready for it. And it's a normal thing to have happen, although it's not ideal. Okay. Sometimes we can help them compensate. Other times we just have to give the answer directly and say, here's what it says. I'm not sure if it's true. I'm not sure if it represents everything perfectly as it really is, but let's work through that together. Something like that. I think negative results, very similar. People don't want to hear them, so it kind of fits with what we just talked about. There's a thing in the book called flat profiles. And I think probably what I'll have to do for this is if I can remember to do this. If you can tell, I'm wearing the same clothes that I did last week, not because I don't change. Or maybe I didn't. Maybe you don't know. No, I'm recording these back to back. So why does that matter? Oh yeah, because I'll have to remember in 2 weeks to bring in an example of this. So if I forget to or whatever, and you were curious about this, I'll show you an example. I can pull one up online. But a flat profile essentially says sometimes it can be difficult if somebody doesn't score particularly high on some scale that indicates, oh, here's where the problem, it's not over here. That's most often what you see. But sometimes someone scores completely flat on their profile, which means it's hard to differentiate that something significant is going on in one place or the other. One of the hardest places where I've seen this show up is in like personality type assessments where people kind of look like they are just a chameleon and they can adapt to all kinds of personalities. It makes interpretation really hard. So hard to make out strengths and weaknesses, as it says here. It doesn't come up a whole ton, but um, the one example that I could probably show you is for you school counselors who are eventually going to be doing some kind of career support or career guidance with people. Sometimes you'll take things like an interest inventory, especially if you're like with high school kids or something. And in high school, you're kind of exploring your interests and you kind of have an idea. But there's always some people who are like, I don't really know what I like, and I like a lot of different things. And so the interest profile says, well, you're the kind of person that sort of equally likes being social. You like working with your hands. You like solving puzzles. You like dealing with data. And so the results look, excuse me, kind of struggling a little bit with my speaking a little bit here. But the results look like you don't really have strong interest in one area. It looks like you're interested in everything almost equally, which means, and this is a little kind of going down this rabbit trail of career assessment, but it means that somebody probably is going to have a harder time making decisions. Because if you say, well, let's try a job being a land surveyor, and they're like, oh, that sounds fun, but I also want to work with people, not just be outside all day looking through the little tripody things you see people on the side of the roads with. And so those kind of folks get into situations where they have some career dissatisfaction because they just say like, well, I want to try everything and like it all equally. I don't have preference. And so like things just don't get as exciting, or you don't get that feeling of like, I'm meant to be here. On the flip side, if somebody has like one strong interest, and they're like, this is what I want to do. Oh, God, here we go again. I am built for this kind of work. If they, for whatever reason, get injured or they get fired or they can't find a job in their area and then they have to switch careers or do something different, that can be a big struggle for folks like that. So there are pros and cons to it, and it can be really hard to interpret those kind of results. It can be done, but they're just tricky. So most of us won't have to deal with that kind of stuff, though. But just so you know, those are some case scenarios where things like this come up. Motivation and attitude, not wanting to see the results they may feel are imminent or think the whole thing is stupid. These are kind of related to what I was talking about earlier, but the one different thing that I didn't say is that sometimes people will have to take a test that they just don't want to see the results. Sometimes that can be because they just don't believe it's true anyway. Like, I'm not an alcoholic. I'm just here because I got caught. And the police were being jerks that day, but they probably could have let me off. And the judge was just, he had a stick up his ass. So, like, whatever. It's not my fault. So, I think this whole thing is dumb. It's not really a problem. Which, coming from our lens, we might see that as just a pretty classic defense mechanism of denial, right? I mean, that could also be true that, judges are that way and police officers are that way. But, it's maybe not as likely in that case. On the flip side, sometimes people are like really grateful to have a diagnosis because it explains something that they've been scared of and wondering about. And then there are other times when people are like, I think it's probably true that I have this diagnosis, but I really don't want to accept it because I really think it's true, but it scares me what that means. This isn't really a counseling example, but I had to, there's a genetic condition that runs in my family. And a few years ago, I chose to take a test. I didn't want to take the test for a while because I was like, this is just a glimpse into my own paranoia, but I was like, I don't want it to be documented because if the insurance finds out, and then this is back when like the ACA, the Affordable Care Act was a big thing, and there was all kinds of talk about insurance dropping people for pre-existing conditions and that kind of stuff. And so I was like, well, I don't really want to get something in writing and documented if I'm going to be dropped from my insurance eventually for this condition that I might have or might not have. And it's not going to affect me later on in life anyway. I'm not going to change my habits or behaviors, or I'm just going to be as healthy as I can. That's what I was trying to say. Um, so when I went in and decided, okay, I probably should do this just to know, after being kind of talked into it by my mother and my sister, when I did that, I was like, I don't even really care about the results because I don't want to know. Because if I know, I don't really know what that means for me, except I think it's gonna get used against me, insurance or something, or at least that was my fear. Is it? I don't know. Probably not. Maybe not. I don't know. Who knows? But that was my fear. And that's what led me to this. Like, I might feel like the results, oh, I just think it's probably going to be true, but it's not. And it's just all a bunch of fears in my head that really were unfounded. Right. So that's just an example of how some people can go into situations and say, I'm scared of what I think is probably going to be true and what that might mean for me. So take it how you will. Um, there is also a section, this is particularly relevant to you school counselors. So you might want to go take a peek at page 399 about giving feedback to parents. I think that could be particularly useful. Um, or I should say, it's there, whether it's useful or not, you can determine whether you think it's helpful, but getting practice talking with kids is different than talking with parents. So, um, and then I just leave this question of what to do if parents don't like results and want a second opinion. I'll just give you my response to that. Some people like to say, well, the test results kind of speak for themselves. Like, if the test is inaccurate, then, but these are the results. It's a good test. It's being used by a lot of people widely, and this is the result. You may be inclined to want to lean on that and say, these parents they're always like that, and they're just being ridiculous. If you have that bias, worth looking into that. My standard answer is usually something along the lines of, if you want a second opinion, absolutely go get one. And I can't guarantee the results are going to be different or the same, but you have every right to do that, and I support anybody doing that. When it comes to standardized tests, I say, I did my very best to do a good job, and if you think that this isn't accurate, we can do it again. You can go somewhere else. I think it's worth having a second opinion just to be sure, because things go wrong. It's okay. And then another example is when people come in for counseling. In fact, this just happened with a client recently. They were being seen by another therapist, and I was a kind of a stand-in temporarily to help them until they got into a more structured program. So it's just like making sure they could get through the day safely, while they're waiting for an inpatient setting to be available. And so I wasn't really I wasn't intending to like work on something significant or like come up with this big like treatment plan, because they were working with a long-term therapist and then waiting for a more structured environment, and I was really just helping maintaining safety. But as we got to talking, I said, if you want to spend time here and it's just good to do, like talk about your day or just like check in on do safety checks and stuff like that, then great. But if you also don't think that what I have to offer or this time with me is spent well, then let's find somebody else, because I don't want you to waste your time on this test or with me as a counselor. Or, if these aren't helping you, then I want what's good for you. I don't care what's good for me. So, I mean, I do to some degree, but like this, it's not important that I feel like you need to come in here for me. This is your time. If you want a second opinion about this, I'll support that 100%. That might mean that you have to find out how to pay for things or take more time out of your life. But absolutely, if you, uh, different story, if you guys went to the doctor and you were like, this doctor doesn't really seem to like get it, or they're not as attentive to my specific requests, or I just didn't get the sense that they had really trustworthy results, you would want to just go somewhere else. Some of us are like, oh, maybe it was a bad day, or just justify it. But you have every right to have a second opinion or distrust results. If you're continuously distrusting results, that might say more about you than them. But, you know, These are tricky things. And we want to get it right. That's the whole point, is we want to get it right for them and for us. All right. Now we're going to talk a little bit about reporting. And as we get into the final project and describe that a little bit more, in fact, probably this week, I haven't looked at the calendar when this is going to be discussed, but probably this week is when I'm going to start explaining final project and go into the reporting part. We will have talked likely about SOAP notes and DAP notes, which is the stuff that you clinically and continuously report on each session. But there are times in which you're going to do more comprehensive reports. And I'll say this in class too, but 90% of you, maybe 95% of you, are not going to write reports like the ones we're going to describe here and the one we're going to practice in class. The reason we're doing it in class is for training purposes. We want to be able to see as many of the big picture parts that go into a full and complete assessment, even if you won't be able to address all of those in great detail. We're going to take a big zoom out telescope lens view of this whole thing. And then in practice, you can hone down on that and kind of bring out your microscopes and look at individual people or individual programs or whatever it is. But for the reports, we're going to practice one, even though it's not really applicable, but it will help provide context for all these nuances that we're discussing here so that you have a wider range of skills going out into the practice later, okay? So the purposes of writing a report or communicating an assessment result or something like that is to describe results to clients. That's self-explanatory now, probably. To record and interpret the client's performance on instruments. In other words, we want to preserve that information so it's not just in their head or my head, but it's somewhere else in writing for our own memory, for their memory, for legal liability purposes. Those are all important. If there's a referral source, we want to be able to communicate back to a referral source of what happened or, what is the outcome of our work, something like that. And so I already mentioned the example of like court-appointed clients. Sometimes the referral source isn't who's referring people in for counseling, but who's funding a program. So that's oftentimes where people are documenting, is they're documenting to justify the efficacy of some kind of program, which injects incentives to provide positive results, which is a whole different conversation you'll probably have in your research class about program evaluation, that kind of stuff. But communicating to who's paying or who has vested interest in an outcome is what we're talking about here, okay? When we get into the first day of our final project, we'll talk through some examples of referral sources, because that's something we'll do, and this will make a little bit more sense once we get there too. And then finally, you get a referral for some kind of assessment, you do the assessment, and then you make a recommendation or have some kind of outcomes or treatment plan or something to give people based on what the results are. So hopefully that makes just really, it's kind of common sense sort of stuff. Here's the reason we're doing it. Here's the work we did. And then here's the outcome of it. That's really the whole big picture of what we're trying to do here. Now, this is the part, this number 2 here, this is the stuff that we'll have another slide on too. So how do we tell what's good and what's not good? I'm going to probably grade on a few of these things, and but I have specific things that I tend to grade on or focus on. And then I also will give you more individualized feedback based on you and your situation, the things you're good at, the things you could work on, that kind of stuff. So I don't look at all of these, although I try to comment on most of them as much as I can. One of them is the use of jargon. We've discussed that, how much you're talking like a counselor in ways that other people don't understand. A lot of people know what CBT is, but a lot of people don't. So if you're like, I'm a CBT therapist who blah, 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 and they're like, what does that mean? I don't know. If I was just getting a referral. I had like a pain in my foot or something because I was running and I'm getting old. And so now I have a little bit more kinks and creaks to work out in my body. And so I was at the doctor and I was like, yeah, I got this pain in my foot. It's not really that big a deal, but like if I want to exercise, I could get it looked at or something. And he's like, well, maybe you should go see the podiatrist. And I was like, oh, which one's the podiatrist again? What do they do? You know what I mean? So even some of us think about the names of medical providers and we're like, I don't really know what an internist is. I know what an intern is in the counseling sense, but if you see an internist, what does that mean? Again, is that a real doctor or is that something else, Or like even the difference between an MD or an OD, a doctor of osteopathy. I had to look that one up a couple years ago because I was like, is that a real thing? I don't even know. So like the point being is that even though there are smart people out in the world, they don't know our world. They don't know all of our jargon. And so we have to talk with enough jargon to show our expertise and show why we know what we're talking about and use those terms and those acronyms and some really heady explanations if we're writing to an audience of psychologists and psychiatrists and other providers, but also clearly enough so that people who don't know anything about that world can understand things too. That's the trick, is like managing that balance. Some of these other ones, self-explanatory. Poorly defined terms. If there's a term that somebody, like, you think it's common knowledge, but it's not for everybody, they're going to say, what does that mean? Can you explain that to me? And that's just something you need to define and explain. Abbreviations that you're using but aren't describing, or spelling out first and then in parentheses. It's kind of a standard thing that we do. So making sure we're clear about those depending on the audience. Or illogical explanations of results. That one's self-explanatory. In fact, that's one of the big areas of feedback that I'm going to give. Here's the referral source. Here's what you're trying to find out. Here's the assessment that you did. But when you give the results, they don't really explain all of the symptoms that led to that diagnostic conclusion. Or when you say there's a cultural bias here, there's a cultural influence here, that cultural influence isn't taken into account in the results. So those are tricky things that I'll help navigate through as we're doing our work. Vague recommendations. This happens all the time, and sometimes I approve and sometimes I disapprove. Some people like to write in their case notes, client is here for, marital counseling regarding interpersonal conflicts with partner. And then the treatment is 6 sessions of CBT to be evaluated further after 6 sessions or whatever. And you're like, okay, yeah, CBT, I know that's a thing that can help, but they're here for marital conflict. How do those two things, like, they don't necessarily make sense of why cognitive therapy is meant to change the thoughts of somebody, but what if the spouse is being a jerk? It's not their thoughts, it's something else. So like, they just don't always add up. That's the logical conclusions we're going to try and work on, of like, are you explaining enough to say why this treatment is important and necessary for that condition? Okay. The simple way is just to say, we're going to treat those symptoms with this outcome, with this kind of treatment. So like depression, we're going to offer counseling. That's like the bare minimum. But when we're talking about like specific interventions, we want to be a little bit more clear and logical about conclusions and where they came from. For organization, that is one that you'll hear me talk about quite a bit when I talk about like the aesthetics or the way my eye gets drawn towards certain kind of information. And you might be like, ugh, this is ridiculous. Why do I have to do this? Aaron's just being really anal about this stuff. And that might be true. Also, when you start looking through medical records and other people's evaluations, and you're like, I can't make freaking heads or tails about any of this stuff, you might start to see like why it's helpful to pay some attention to the way things look. There's a little bit of an analogy, like if you leave the house and you don't look at the mirror and you got food in your teeth and your shirt's untucked and you got like, I don't know, you get like one of those what do they call those, dryer sheets hanging out of the back of your skirt or something like that. You know what I mean? Like, you just go out and people are like, oh boy, they're not really paying a whole lot of attention to their appearance this week. Or if you don't smell very good, people make judgments, and those things do matter, right? They don't matter in terms of like your worth and value as a person, but they do matter in terms of what kind of relationships you're going to encourage people to have with you. Do you want them to have trust that you are put together, you're focused, you're presentable, like presentable, being present with people, that kind of way? If so, then taking the time to just pay attention to your presentation, both your dress and clothes and hygiene, but also your written reports, to make sure they're consumable and approachable by other people. So I will give you feedback on organization, even though it might be a little bit pedantic. Emphasis on numbers rather than explanations. Sometimes we can lean back on the numbers because we feel confident because they didn't come from us, and we're worried about our own explanations, or they whether we feel like we have the authority to give them, or we like the way we do it, or whatever. So sometimes some of us do that. Or exclusive use of computerized results. We talked about that one last week. We already talked about jargon on this slide, so we'll skip over that one. Refer to yourself in third person. People are all across the board on this one. Can you use your name in reports? Do you just say the client, or do you use initials, or do you write their name? Do you use the counselor, this therapist, this author? All of those things are done. I've heard opinions about every single one of them, and I don't give a crap about any of them. Like, I just don't think there's like a standard. People do all kinds of things, and does it really matter in the end? I don't see any reason why it matters. Maybe it does. In some circumstances, maybe there's a reason to do it one way or the other. But what I honestly do is if I go into an environment and someone says, "Oh, we write it this way," I just do it that way. I don't care. Like, it doesn't really matter to me. Someone says write about yourself in third person because that's just like the convention of this agency or this industry or whatever. I'm like, all right, fine. Who cares, you know? So if you're worried about like, should I be writing this? Should I not? I don't know. Maybe I should have a more solid answer for you. But for those of you that are working with people that say, yes, this is how you should do it, then just do it. Who cares, you know? Maybe someone will tell me something that will make sense to get through my thick skull one of these days of like why one of them matters more. But every time someone does try to explain it to me, I'm like, that sounds like just your style. It sounds like your opinion, and there's nothing wrong with that. But don't force it on me, you know, like that kind of thing. So, number 3, use simple words and concise sentences. We'll practice that one. I've given you enough rationale of when and why and how it's important to consider it, and then we'll just practice when and why and how to do it. So, avoid redundancies. That comes up quite a bit actually in our final papers of like people saying things over and over again in different places. There are some times in which you just have to do that and you'll be told to do that. But for clarity purposes and for conciseness, it's good practice to try and avoid it. But like when you're filling out forms with different information in it, sometimes you just have to be redundant. It's just the way it is. So uh if you for number 6, if you remember back to your writing classes in high school and you had one introductory paragraph, 3 supporting paragraphs, and a conclusion, right? And then, well, maybe that was like earlier than high school, but you know what I mean. And then you have a thesis statement at the beginning of the paragraph declaring all the things you're going to describe, and then you describe them, and then you sum them up at the end in a conclusion sentence. That's just sort of standard, the way we standardly talk about writing, okay? In the scientific community, that's the expectation here too. So the point here, number 6, is begin with a strong declarative sentence. Client shows symptoms of depression. Symptoms of depression include XYZ. And then the conclusion is, I don't even know what the conclusion would be in that paragraph, but like, hopefully you get the point. Make the statement. Some of us do that backwards, and I'm guilty of this all the time. But I do it backwards. I say client displays symptoms XYZ, which leads to a conclusion of depression or a diagnosis of depression. What they're saying here for the purpose of clarity and for the convention of the field is if you want to get used to this stuff, try to make your statement clear and specifically at the very beginning. I probably will miss that, and I don't think about it because I'm not good at it, but it's something that you can get in the habit of practicing because it does really help clarify your writing. One of these days I'll internalize it and get good at it, but I'm just not there yet. So I will accept my loss for the moment and then practice when I feel ready to do it. Write background information in past tense. One of those things just to keep in mind. Tense does writing in the correct tense. Client is, client was, client will be. Those are all ideas of tense. It's just one of those like can make you better at writing kind of things. If I notice it, I'll mark it out on your papers. But I also think it's, it does matter and it is important. And it's not the biggest priority for me in terms of my feedback for you, but that's something you can pay attention to. It'll help your writing get better. Write assessment results in the present tense. That one is kind of important because sometimes you'll be like, for example, if you have a client come in on a Friday and then you're writing your report on a Monday because you just ran out of time or something, and you say client was because technically their report was on, or their assessment was on Friday, and you're writing to people in the future who are going to think back to that one day of what was the client experiencing that day. But you want to try and write in the present tense of the client is. At the moment of assessment, when I'm making this clinical decision, client is. Um, because it's assumed that the condition you're experiencing is something you're observing right now. So it can be helpful to remember to write in present tense when you're talking about the client's outcomes, the client's results. Okay. I mess that one up all the time too. So again, just you don't have to like be too concerned about it, but it's something you can do to improve and get better. Information irrelevant to the purposes for the assessment generally should not be included. This one we'll work on pretty heavily when we work on our projects of like you'll be inclined to gather all kinds of information about the story the client tells you and all the details, and you'd be like, I capture all of it. And if there are things that really just don't matter and aren't relevant to the purpose of the assessment, then you don't need to include them. Okay. So this is hard. This is hard to get good at. But one of the normal things that people do is we get really trained well in programs like this and many others to focus on the story of the client and getting their details of their family background and the nature of their relationships and all that kind of stuff. As we've talked about in class, I think that stuff is really important. But if your report is coming from a referral source to do a career, let's just say we're doing a diagnostic evaluation um, following substance abuse requirement for a DUI. So they send them to you, and you're going to do a diagnostic evaluation, not for substance use, but for potential some mental illness or something. And you're really just looking for mental illness, not substance abuse, not you'll assess for trauma history, but they want to know about a diagnosis, not about the whole trauma history. Does that mean I have to get a ton of background on the family about their trauma history and all that kind of stuff? There some, yes, because it will be relevant to the diagnosis. But if you have a bunch of details about parents and sisters and siblings and all that kind of stuff that don't really have anything to do with the condition of the client, then you don't need to include it. For example, client had a sister, but the trauma comes from parents' divorce. So their parents are important, sisters really not. So do I need to include that? Not really. And that's one of the hard things to determine. It just takes time and practice, quite a bit of it actually, to get good at like what matters and what doesn't. So it helps you write less so you don't need to write more stuff. And it helps clarify what actually is important here that justifies the conclusion and gives the referral source what they're looking for. So that one we'll get more practice on. Capitalized test titles, that seems nitpicky and anal, but do it, I guess. I don't know. I don't know what to say about that one. Pay attention to punctuation, capitalization, spelling, and grammar. That one goes without saying, probably. So hopefully that helps. Ask questions if you want to, but we'll get some practice with those things as we go. Now, I am giving you a template for your final project, and I'll talk to you more about this when we get to the final project, but you can adapt that template to meet your needs. I can't remember if I said it earlier today or if it was in last week's lecture, but if you're doing a career evaluation, you're probably going to want a section in here about work history. If you're doing a trauma evaluation or a diagnostic evaluation for PTSD, and your client has a medical condition, you might want to add in the medical condition up there. So this isn't like a hard and fast, this is what you have to have. This is kind of the general standard sections that most people have. Another one that you'll see that's not really on this list and it doesn't show up all the time, but is like an executive summary. It's a little bit of background for where, like how a person got here and what sort of the general purpose and outcomes might be of this evaluation. So we're not going to do all that stuff, or we're not going to do that part probably. Some of you might do it a little bit, but these are the general categories: the title and identifying information. These are client demographics. This is who's doing the report. This is birthday. Sometimes you need address. Sometimes you need phone numbers. Those vary. The kind of identifying information varies greatly depending on your site. Okay. The reason for the referral, Sometimes it's not even necessary because everybody who sees you comes for diagnostic evaluation. Other times it's really important because the referral information has a lot of content in it about the nuance of where they came from. This doctor sent them over for this kind of evaluation. They were given medicine for major depression, but the doctor's recommending treatment, and you want to do an evaluation to justify that medical decision to diagnose with depression. Find more nuance with it or something like that. See if there's something else going on. So that referral source, we'll get practice with that one. That'll become a little more clear as we go. Background information, I'll explain more about that one as we go. The behavioral observations, we'll have a class period where we'll talk specifically about the mini mental status exam, or the MMSE. It goes by other acronyms, MMS, mini mental status, stuff like that. But basically what it is, we'll get into that a little bit more later and explain what that is. Assessment instruments and procedures is what it sounds like. We'll use some tests and we'll explain them, just like we did in that assignment where we did the PHQ and the GAD-7, and we practiced kind of like writing up what the test is, what the scale is, what the results were, and then what they mean. That's what this section's for. The results in interpretation, this is like what all of the tests that we do together explain or describe. If you're going to do an anxiety and depression inventory, because you're not sure which one is really present, then this section, the results, say, client scores positively for depression, but not anxiety, but still has some symptoms that are worth considering, something like that. That's a very brief explanation, but we'll get some more practice. And frankly, so many of you did an excellent job and the rest of you did a good job. Kind of maybe sounds funny to say, or funny to hear. But you guys did a pretty good job of explaining that. Now we'll just add some layers of complication and let you get better at it. So I'm not really worried about that one for you guys. The summary and the recommendations, for those of you that are going to be working in clinical sites, and it's part of the convention of a clinical diagnostic report is to have a specific section that reports diagnoses, and the recommendations then are the treatments. So we'll talk about the nuances of like what the assessment results are. That's not the diagnosis, that's the result of the specific assessment. The summary or the diagnosis comes differently, and then the recommendations are how we're going to treat it. Now, I'll say this again later, but the recommendations, we're not going to focus too much on those in this class. This class is about the assessment, not what we're going to do with the information later. So I really won't care all that much about that section, but I will give you some feedback in terms of like how I'm conceptualizing the client that you have and what you might think about in terms of how you can treat these or work with people in those situations. So we'll dig more into that one, but I'll give you a template too to start with. We've talked about communicating with other professionals and the public. The public is mostly going to be relevant to those of you who are working in schools, because you might get asked to send an email out to parents about an assessment procedure that you are going to be doing and asking for their consent, or the results of whatever assessment, or the results of something. If there is a knock on wood, heaven forbid, there's some kind of like major crisis at the school, sometimes they ask school counselors to provide some input or feedback to parents about what's going on. Usually that's not about specific assessment results, but it is about like, how you're evaluating the health and safety of kids. So like that, these things could be relevant, and all of the different nuanced ways that happens. I'm not really going to be good at explaining all of those, but for those of you who are in like clinical mental health settings, most of us just don't do a lot of discussion with the public. The one thing I can think of that might be relevant is probably more related to the ethics. But like if you have a blog, or you're producing content on social media or something like that, that's a little bit different than I think what we're talking about here, but it does, I think it's maybe kind of relates to, I don't know. I guess today, as I'm sitting here, I'm not feeling that competent about talking to the public or like in what ways I would communicate assessment results to the public, unless you're part of like a, some public health initiative or something like that. But anyway, the relevant parts here though are, who are you talking to? Who is your audience? And that I think is pretty self-explanatory with the list up there. Is it parents? Is it attorneys? Is it counselors? Is it the general public? Like, who is that? That matters. Um, One thing that is relevant though to point sub point one here is it's a good idea not to assume that other people know what you're talking about. It's really challenging when you're learning this stuff for the first time and you're like, I feel like I'm a learner, and so other people know more than me, or I'm on some sort of equal level than my peers. But one of the things you'll find out as you go through this is like what your specific expertise is. You'll meet clients and you'll meet other counselors who are like, I just don't know much about that diagnosis, or I don't know much about working with that population of people. And you're like, oh, I do. That's my thing. Like that's what I'm really good at. And it can be tempting when you write to other people that they actually kind of know what you're talking about, but they don't always. And so I'll try and help give some context for those kind of things, but you'll also just learn a lot more about what your special knowledge and what makes you unique as you grow in this career, because you'll get to say, like, here's what I can provide people that's different. And that shows up in a lot of different ways. I won't go into a bunch of them, but like you'll find out over time that you are your clients or your perspective, your special training uniquely positions you to offer something to your community. And my recommendation to all of you, and this doesn't always happen, but if you get involved in professional organizations or you just find some medium for sharing this stuff and like trainings like outside of your work, share that stuff, because that's how we help each other get better at things. What this looks like in practice is um, when somebody's really good at working with like in with forensic parental evaluations, like, you know, parental fitness kind of things, or like, is this person fit to be a parent? And the courts sometimes will consult with counselors or pay for them to do an evaluation. That's a really unique, specialized niche kind of thing. And so I see people provide trainings for other counselors on like how to do that. If you work with uh if you have a you want to specialize in working with uh um uh blanking on the term, but like depression after you have a baby. What is that called? I've been talking for too long today. Some of you are screaming at your screens right now. I can tell. Like, just kind of saying the word, and I'm stalling, just talking because I want to remember it. Uh, I'm not gonna get it anyway. You know what I'm talking about. Um, if that's your specialty, not everybody else knows about that stuff, or men's health issues, women's health issues, kids issues, like that kind of thing is a nuance that you have that other people don't. The reason I'm really going into this deeply is that it's hard for us to identify what do I know that people don't and what's the value of that information. So when you're communicating to other people, it's just a safe assumption to check in and say, how much do you guys know about this? What would be valuable in terms of understanding? Like, how well versed do you think you are? And even when people, I talk a lot in front of other people because it's part of my job. But even when I go to talk to other academics, academics are world famous for saying like, well, I know what I'm talking about. I know about all these things. I can't believe you would have something to offer me, but I will give you the time of the day. Not everybody talks like that, but there's the sense of like, I'm well informed. I know. Um, but I still assume that people don't, not to belittle them, but to say, I'm going to explain to you how I understand these things, even if you think you know about them or know more than me. I still need to give you my context so that we're speaking on the same plane here, so that we're understanding each other. So that starts with assuming that they don't always know what I know, or at least in the same way anyway. So it can be helpful to do that kind of thing. So, um, and then I'll mention equal or greater training doesn't mean that it's equal or greater. So leave that the way it is. Think about what information they need and what you can offer. I think we've already talked about that, but in ethics, if you had it with me anyway, we talked about privileged communication and privacy. If you haven't had ethics, I hope you get to what are you doing? Oh, you guys want to see my dog? She's goofing off back behind me. This is the old lady. She's 15 years old and she does not like being picked up. I think she's bored or she has to go to the bathroom or something. Okay, now back up. Back up. Thank you. I love you. Now go away. Just kidding. Okay. Hopefully you will cover what privileged communication is and privacy. But we have that confidentiality stuff to talk about and think about. So that's maybe worth a conversation, but I'm going to leave that one here for now. Actually, no, I will say one more thing about it. Sometimes you'll have people who want information from you that you just don't have the professional capacity to give, and they think that you should give it to them because it'd be helpful, but you just can't. So, for example, there's a classic example with teachers in schools. They have a kid in class, they consult with the therapist or the school counselor. School counselor works with that kid, and the teacher wants an update to say like, "Hey, you met with them. What do you think? How can I help? What can I do? What's going on in their life?" And you're like, "Well, I can tell you some things about what might help you be a successful teacher in working with this kid, but I can't tell you what's going on in his life because that's kind of between us." You know what I mean? So when you're communicating, this is an area where there's a lot of ethical things to consider in terms of what I can and can't share and but I want to be helpful at the same time. So that's a conversation that I'm going to leave largely to. We can talk about it in class, or we can talk about it in ethics class. But those are really, really important too. So who is privy to what information is kind of the thing. And then also get a release of information when you're talking to other people if you're talking about that private stuff. Because if you can talk about it and it is helpful to client and they do give you permission to do it, then get the thing in writing because that's really important. And then I already talked about communication with public. So that's it. We're kind of right on the hour mark. So I will talk to you guys in class, and have a wonderful day, week, month, life, or whatever applies to you. All right, see ya.